All right, welcome everyone to today's conversation. Thank you for taking the time to join. We'll give folks a couple seconds here to sign in. So we're really happy to be talking today with Emily and Adam from their respective outlets. I'll give them an introduction here in a second, but just a little bit of background. We're going to talk about reporting on addictions work related to opioid settlement funds and the billions of dollars that are coming into communities. And our goal here is to try to help journalists cover these different settlement funds and make sure that they have support for their different reporting. We have a series of different Fireside chats over the last couple of years that you can dig into, and we also have additional resources related to a new set of quick guides specific to opioid settlement funds. We also have like a trauma-informed journalism guide, all sorts of resources to help you out, including one-on-one technical assistance if you ever have questions or need support. So I know that not all the folks on the call today are journalists, but I just want to say that today's focus is on journalists. So there will be a time for questions here at the end because we know that this is a super complex topic, especially for journalists. So we're here to try to help them get started. So one way that you can help folks get started is by sharing recordings or resources like this with your local journalists that are trying to cover this topic. At any point in time during the conversation, feel free to drop questions in the chat. And there will be time for a Q&A at the end, hopefully. Emily, I will start with introducing you, and then we'll go to Adam, and then Adam will start going over his part of the presentation. So Emily is a wonderful reporter joining us from Maine today. She's a healthcare and general assignments reporter for the Maine Monitor, where she covers substance use and mental health and access to care. She's particularly interested in exploring how these issues affect Mainers' everyday lives, how communities are seeking solutions, and in serving as a watchdog on decision makers. Prior to joining the Maine Monitor, Emily was a reporter for 3 years at local Maine papers, and she has earned recognition from a number of state and national press associations, including Reporting on Addiction for her wonderful reporting across drug use and addiction. So thank you for joining us, Emily. And then Adam Smith-Perez is an investigative journalist and producer based in Buffalo, New York. He's also a Report for America Corps member and the urban affairs reporter at the Investigative Post, Buffalo's only nonprofit watchdog newsroom. He has reported extensively on the overdose crisis since 2023 for outlets including The Nation and Vice News, and most recently covered oversight issues surrounding opioid settlement funds at the Investigative Post. In covering urban affairs at Buffalo, Adam has also reported on police misconduct, immigration enforcement, and affordable housing. So thank you again, Adam, for joining us. And I just want to flag, too, that both Emily or Adam are Reporting on Addiction Microgrant awardees. So that's a small grant that we provided these reporters to help them get started, or in both cases, really dig a lot deeper into opioid settlement funds. So I'm very excited to hear about the wonderful reporting that they're doing today, and I hope that it gives y'all a little peek behind the curtains at the work that they've been doing.
All right, great. Thank you, Jonathan. I will just go ahead and start here. I'm going to walk you through my year of opioid settlement reporting in Buffalo. This is how I've reported my stories. I hope it can be a useful roadmap for you, wherever you are. I'm excited to share how I've gotten to where I am. So next slide, please. All right, so I think for me, in my case, it definitely was just me starting with a hunch and looking at what local news had reported. And within the coverage that you find by local outlets, look out for what leaders are promising. So odds are wherever you are, there's a dearth in local coverage, except for press conferences where politicians get to talk about how they've spent the money. Nonprofits talk about their strategy, potentially with the money. So this all started about a year ago. I pitched a story about what happened to the money given to the Buffalo police and fire departments as part of my job interview for Investigative Post, which is where I am now. And frankly, there was no in-depth coverage at all of how these city agencies use the money a year later, and it felt irresponsible. I had a hunch that something was awry. So I just want to point out in the photograph to the right, on the left, there's just a local news coverage, just like a sort of breaking news hit piece on what happened with opioid settlement money. And then on the right, just to point out, so there's previously we had Mayor Byron Brown, and then you see the different city agencies. We've got the police department officials, fire department officials on the right, and then right to the left of the mayor is Avi Israel and his wife Julie. So these are all the individuals that have received opioid settlement funds, or they represent the agencies that have. 3 years into receiving the money, these are the only entities that have received the money to date. So over the course of my reporting, I found out that the fire department spent over $500,000 on vehicles, plus thousands more on snowblowers, speakers for a fireboat, washing machines, and various other equipment with very little utility in addressing opioid overdose. The mayor spent money on lawnmowers and catering, for a block club event. The police bought a Ford Explorer with sirens and lights for their wellness officer. And Avi Israel and his wife, again, right to the left of the mayor there, they got $500,000 in opioid settlement money to start a residential reintegration facility for women in one of Buffalo's hardest hit neighborhoods by overdose. And several years into the project, it remains unfinished. So since I started reporting, Erie County, which is the county Buffalo's in, and the Maine state agency that has funded Save the Michaels, they've canceled their contracts and to the tune of millions of dollars in funding. And now the Attorney General is reviewing the case, which I'll get into a little later. So next slide, please. So just to zoom out a little bit, since 2023, Buffalo has left millions of dollars unspent. And since 2023, at least 550 people have died in Buffalo city limits. So Buffalo is a city of about 276,000 people. Again, it's in Erie County, which is consistently has had one of the highest overdose death rates per capita in the state. Less than a third of the $6 million that the city has received from the Office of Addiction Services and Supports has been spent. This is a photograph. On the left is a photograph of acting Mayor Chris Scanlon. He took over after Byron Brown stepped down, and he is handing out lawnmowers to block clubs. He and his administration used $11,000 in opioid settlement money to purchase the lawnmowers. Next slide, please. So I think it's really important when you're doing this reporting to illustrate what the impact of this lack of strategy is, or the willful misuse of the opioid settlement money. So here on the left, my colleague and I worked on this data map. The points illustrate the zip codes with the highest overdose death rate in the city. Most often, it is proportionally Black and Latino people who are dying of overdose. And on the right, as this is happening over the past couple of years, the city of Buffalo is spending their money that is designated to address opioid addiction and abatement on various vehicles and vehicle equipment. Next slide, please. So I think with any story you're setting out to do that's accountability driven, you just should ask yourself how you're going to figure out your angles. Where is the local news coverage missing detail? Are officials being transparent about where the money has gone? Who's in charge of the money? Are there public portals to get more data, or data more easily than filing a number of FOIL requests? So I personally lucked out in Buffalo because on the right, I have an image of Open Book Buffalo. So this is a public portal that was created by a former city comptroller. That shows you all of the transactions and vendor checks that have been issued by the city. And allegedly, it's updated every day, which I don't think is true, but it was tremendously helpful for me as a starting point. So you want to look out to see if there is anything transparency-wise, portal-wise that's happening where you are, county or on the city level. So you still want to be very skeptical about the data you can obtain through these avenues. You always want to check with experts who can help you interpret the data. In my case, it was the deputy comptroller, which I can get into in my next slide in a minute. But you also want to be skeptical of the do-gooders, so the influential nonprofits that are getting contracts. At the risk of sounding super cynical, you just want to be aware of how they may be using their political clout for personal gain. And I'll get into that with Save the Michaels a little bit later. Next slide, please. So you really want to foil the hell out of officials. You want to take a double approach, or a double-pronged approach here. Call them before and after you foil. In my case, it was helpful to call the deputy comptroller, but you might want to call the comptroller too. You want to get in touch with the grant managers. Former employees from Save the Michaels were really helpful in sort of verifying, okay, well, the money was really never spent for that. So it gives you a confirmation of what you may be experiencing with a gut check. Foiling early and often, I highly recommend that. And on that note, being really transparent with your editors as this is happening. Like, it's looking like it's going to be a long time. You just want to make that clear throughout your process, depending on what kind of output you're expected to do in your newsroom. So when you're foiling, I mean, this is a whole separate thread that I think merits more time, but you want to find a way to be as specific as possible. And for me, I was able to figure out the requirements for reporting on opioid settlement funds. So for the regional abatements that Buffalo received, the city officials were required to submit all of their expenditure reports by August 1st of every year. So for my FOIL request on the right, I obtained a purchase order and several other things from that request. I asked for all opioid-related expenditures reported to OASIS, the Office of Addiction Services and Supports, by the City of Buffalo since 2023, which may be sort of vague, sound a little vague, but it actually got me what I needed. However, it took me several months. I filed that FOIL, I believe, at the end of October, and I got it last week. So you can also file for email correspondence, RFPs. You want to make sure that you are really organized. I found it useful to track all my FOILs and when I submitted them in Google Sheets. So this purchase order reflects how the City of Buffalo Fire Department used $96,000 on Chevy Tahoes. All right, so next slide, please. So other things that I got, so from a former employee of the nonprofit that got $500,000, I got board meeting minutes. So I included on the right something about how the City of Buffalo actually promised the nonprofit $500,000 prior to them even submitting the RFP. And it says, our ace in the hole is Thurman Thomas, who already spoke with the mayor on our behalf. So again, they're not really playing by the rules. This is a really important thing to know about the nonprofit. As I later pointed out, they were playing by very fast and loose rules, to the tune of now being investigated by the county mental health department, and there's an inquiry by the state attorney general. I have a quote here: "We are the City of Buffalo. We clean streets. We pick up trash. Now that we know more, could we have spent it better?" But again, maybe we could have, but again, we collect trash. So the city had no strategy, and these are quotes that I got from the person who was directly overseeing the spending when I was able to confront her with facts from all my data. There's more that I got from city records that I didn't have to FOIL for, related to how the fire and police department actually spent money several months before it was announced in that big press conference, which gave me important context for how they're extremely well connected and the preferred agency for the mayor and the city to spend all this money. So next slide, please. It's really important that you pound the pavement, knock on doors, and when you get this data, as I was alluding to before, just confronting officials with what you find. Just generally basic journalism 101, you want to make sure that you give them, the adversarial party, I guess you could say, the opportunity to comment, but probably already know that. And then when you have this data you're getting from sources, or you're getting accounts from sources, trying to confirm them with places like the county clerk's office. So this is a photograph of the East Side facility that has been unused for years. They were renovating it. Avi Israel, CEO of Save the Michaels, promised that he would use the opioid settlement money for staff salaries and renovations. That process began in 2022, and no one has been hired since he got this money. $130,000 mechanics lien was filed against him for unpaid labor costs. So again, he's promising to do all this stuff with the opioid settlement money, and turns out he's not paying workers. He's never hired anybody. Former employees told me that he used the opioid settlement money to cover payroll, which is a direct violation of the grant rules. And then he told me it was none of my fucking business when I asked what was going on with the contracts and with facility closures. So 2 of the facilities of Save the Michaels have closed in the last month since my reporting has come out. And that's a result of the county and the Office of Addiction Services and Supports canceling their $1 million contracts. Next slide, please. When you get the data, try and find a way to organize it in a way that works for you. This is a lot visually right now. Definitely maybe revisit this if it's helpful, but using Google Sheets worked for me. I was able to organize my data pretty well, and I shared this with my editor early on in the process, but it basically framed it around the question of, or I organized it around, like, how did the city agencies use the money before the press conference? And then I made notes below, like, they promised that they would use, the fire department promised they'd use money for mental health contracts and locked drop boxes for medicine and needles, which it's a separate conversation, but those are also dubious uses for the settlement money. And then, generally these vehicles have very dubious utility. Next slide, please. So the last slide, I want to just zoom out again and just reiterate that I think it's really important to ground yourself in the human cost of what happens when the settlement funds are misused or underutilized. On the left, this is a source of mine. Her name is Rayshawn Scott Williams. She runs a mobile outreach program here in the city of Buffalo, and she's lost her niece and other relatives to overdose over many years, and she's committed to on-the-ground outreach. She's been doing this for 8 years. She runs services out of her vans, or actually her one van, which is about to break down. And on the right, this is a picture of me and my sister at my college graduation in 2014. My sister died 2 years later of a fentanyl overdose. So remember, as much as it's important to follow the numbers and frame it around the money and how it's not being spent, you have to remember that this reporting is about human beings. It's about our loved ones. It's about families who are directly impacted by misuse and underutilization. And I'll end on a quote here that Rashawn gave me. So the funding never went to the parents. It never went to the people who died. It didn't help pay for funeral costs. And that's a disservice to the people's lives that were lost. It's a disservice to their memory. So I think you have the opportunity to affect real change with this reporting, to make public officials rethink policy, to shake in their boots a little bit, and to make systems better. So get out there, do the work, take a deep breath, take some breaks, and I will put my information in the chat, and you can reach out to me whenever. So thank you.
Adam, thank you so much. I know that you know this, but huge fan of the work that you've been doing, and it's really cool to see the impact of the work that you've been doing as well. These are real things. These articles are having real change in how the community is thinking about opioid settlements funds. So again, just love what you're doing. I shared a link to Adam's reporting in the Investigative Post, but feel free to obviously reach out and stuff as well. Adam said he's going to share his contact information. And then folks, of course, feel free to drop questions in the chat. Adam, I loved your Google Sheet. There's more that we can do to help journalists think about how to structure this data. So thank you for sharing that, and we'll make sure that we are providing those supports going forward too. All right, Emily, on to you.
Okay. Can everyone hear me okay? Okay, great.
Yes.
So I know Jonathan already introduced me, but just real quick recap. I've been at the Maine Monitor for 3 years. I was previously a healthcare reporter in Lewiston, Maine, which is Maine's second largest city. I cover healthcare, and I have a particular focus on addiction and mental health. And I've been 2 times reporting on Addiction Micrograntee. The first story I did was in 2024. I did a story about mothers in recovery, specifically mothers who are looking for a place that they could bring their kid with them to a recovery home. And I'm going to say right now, I have a very annoying dog at my feet, and I apologize in advance if she barks at me. Okay. And then the second microgrant was just recently for opioid settlement reporting. So I've been reporting on the opioid settlement since 2023. At the time when I started reporting, it didn't really seem like anyone was paying attention to the settlements. I mean, there had been some reporting in Maine, but not really any in-depth reporting. So my very first story was an explainer, and it was an overview of what the settlements are, where the money comes from, who's receiving the money, how it can be spent. And that was a really good way to create a foundation for my reporting, because I had to learn about everything. And so I would say for anyone who is wanting to get started on reporting, that might be a good place for you to start too. We are 4 years into the settlements, so someone in your state may have already written this, but if they haven't, maybe you should write that, or at least get familiar with how your state is distributing its money, which I'll get into in a second. So on that note, where I would start and where you should start and where I started was find out how your state is dividing up its money. So this is the first 2 pages of Maine's Memorandum of Understanding. That is basically, it's a document that says this is how Maine is dividing its money. And it also explains who, the percentages, who are the decision makers, who must be transparent with their spending. It just gives you a good background. And if there is no memorandum of understanding, I don't know how every other state works, just ask your AG's office. How is the money being divided? And I would also suggest opioidsettlementtracker.com and KFF Health News's Payback Project. Those are 2 really excellent resources that I use quite often. If you're just getting started and don't know where to go, I would just go there and they probably have your questions answered at this point. So the other suggestion I would make when you're getting started is familiarize yourself with Exhibit E. So this is basically a document that just describes all the approved uses for the opioid settlement funds. And I like to describe it as a detailed yet broad document. I know that's oxymoronic, but it's, I think, 15 pages long. It gives lots of different examples of ways the money should be spent, but there's still a lot of room for interpretation. And the settlements themselves don't have much accountability built into them. So that's where seeking out the voices of community members, advocates, people with lived experience, experts, and hearing from them about how the money should be spent and where the greatest needs are really important. And then connecting that also back to Exhibit E to see, does it even fit in here? Are we even at right space? So these are some questions that when I'm thinking about like getting started and where I kind of start every story, this is where I start. So one, again, how is my state's share getting divided? Who are the decision makers? Is there a statewide council? Is it all divided up among localities? Who's ultimately deciding how the money gets sent out? What spending information is publicly available? So in Maine, for example, well, now everyone has, 70%, 80%, of the money has to be publicly reported. But different states have different reporting requirements, and opioidsettlementtracker.com, I believe, has an entire table of that, and I think maybe KFF Health News as well. But what is already publicly available and what isn't? And for the information that's not publicly available, how can you get it? So like Adam was saying, in Maine it's called a FOA, like a FOIA. Just pepper your state or your community in records requests, find out how you can get that information. So what is the decision-making process? Are decision makers holding public forums? Have they formed advisory councils? Are they conducting needs assessments? Do they feel prepared to determine the best use of the money? In Maine, for example, there's a lot of small cities and towns that are already strapped for time, that are not public health experts, that do not necessarily know the best use of this money. And so now they're scrambling to figure out how to spend millions of dollars. And then of the money that has already been spent, what has it been spent on? And again, do community members, advocates, people with lived experience, public health experts, do they think this money is being spent wisely, and why or why not? So again, it's not just, you're not just looking into how the money is getting spent, but you want to connect it back to its ultimate purpose. You want to remember that this money comes from years of mislabeling of Purdue Pharma's harmful and deadly advertising campaign, essentially. So I hear a lot when I talk to advocates, like, this is blood money. So because they feel like this money came from all, friends and family dying from opioids. And now this money is meant to be used for opioid abatement. Is it actually doing that? Are they doing that? Or like Adam's example, are they spending it on police cars? And if they are, ask them how that connects to opioid abatement. So in other words, put them on the spot and make them explain. And lastly, are decision makers monitoring and evaluating their spending? If they're putting it into a new program, are they tracking its impact? If they are tracking its impact, what does that look like? Are they reevaluating in a year, in 2 years? This is not just one time, one and done. Are they actually tracking if it's making a difference? So overall, I would say you can start small. You don't have to tackle your entire state. So start with your local community or your local county. And and one of the number one things I would remember when you're looking at spending and trying to determine how it fits in, not only are you trying to connect it back to the approved uses, but also remember that one of the things you will hear over and over again is supplement, not supplant, which means, are the decision makers using the funds to plug budget holes, which would be supplant, or are they using the money to expand or create new programs, so supplement? And that's a really important question to ask, because you'll probably notice as soon as you start reporting that there is a lot of plugging budget holes. So these are just a few helpful resources. I mentioned opioidsettlementtracker.com, KFF Health News, opioidsettlementguides.com. They have ready-made guides for each state. Those are really helpful if you just want a quick and easy explanation of what's going on in your state right now. Of course, reporting on addiction. And then I mentioned some of the trust websites. I think that's like getting into the weeds a little bit, and you certainly don't have to do that. But if you like to get into the weeds, they're there. Otherwise, I would say opioidsettlementtracker.com has pretty much everything you need. So a little bit on Maine settlements before I go into some of my reporting. So Maine's settlements are divided 3 ways. 50% goes to the Maine Recovery Council, which is a statewide council where all the meetings and decisions are public. 20% goes to the Attorney General's office. Besides, public record laws, those decisions are not necessarily public. There is a forthcoming dashboard that I've yet to see that should be published soon, but they're not meeting in public like the Recovery Council. And then the third half is 30% to the direct share subdivisions, which are, in Maine, 39 county, cities, and towns. And until very recently, they did not have any public reporting requirements. So when I was getting started, I attended a lot of the Recovery Council meetings. It's really good to show your face at these sorts of meetings. I was often the only person there in person, and council members got to know me. So then when I had a question and I would text or call someone, they would be like, oh yeah, that's Emily. She was, the only person sitting in the room with us. And that's a really good way to just meet people and meet sources as well, because at least if there's some sort of advisory council, because at least in Maine, there are people from different backgrounds in different parts of the state. And so getting to know them and reaching out to them was really helpful for future reporting. So like I said, until recently, the direct share subdivisions were not required to publicly report their spending. So for the last 2 years, I sent surveys. On the left-hand side of the screen is an example of my most recent one, which is from March. And each one varied a little bit, but it was basically, how much money have you spent? What are you spending it on? Who can I call? And that was the way that I was able to get information when there was no public database. I created the database. And I never got 100% participation, but I came pretty close. And basically, I was able to create the most comprehensive database of subdivision spending available until very recently. I've also requested spending data from the AG's office a couple of times, most recently in December for a story I wrote. And then last year, the legislature passed a bill that required the subdivisions to submit annual reports starting this January. I forwarded for those reports as soon as they were due, which was what I used for my microgrant story, which I will come back to. So these are 2 stories that came out of the first 2 surveys I did. And it's an example of both of the kind of stories that can come from just reaching out and asking people how they're spending their money, and also an example and a reminder to follow up. So on the top left, you can see I wrote, in September 2023, Franklin County hopes to start distributing opioid settlement money by the end of the year. When I checked back in with them in March or April of the next year, the committee had been dissolved. It was a mess. People were finger pointing. And so that led to not only follow up with Franklin County, but it also led me to ask all the subdivisions, well, what's your spending process? Do you have bylaws in place? Do you have how are you deciding who gets to serve on this advisory committee? So there are a lot of, I did some sort of big, this is how everyone's spending their money, but then I also broke it out into smaller pieces as those interesting stories came up. Here's another example of a story that can come out of settlement reporting that's not necessarily directly related. So this came out of, I was watching the Recovery Council's first round of grant making, and I noticed that there was a proposal for a recovery high school in a very rural part of the state that was rejected. A month later, I was at the Recovery Council's annual public forum, and a couple of educators from the school had come down and basically said, please reconsider, we desperately need this money, or we cannot start this school. And so I called them up and we talked about it, and this turned into a great story, and they ended up getting funding. And so this brings me to my microgrant story. So I submitted FOA requests for the legislature reports, and I got them back about a month later. And I was able to quickly sift through the data and get a story published right before the first public report to the legislature. Something I will note is that these reports only covered spending in 2025, so I still have more information than the state in terms of previous spending. And there might be some future legislative fixes to that, but for right now, all the work I put in over the last 3 years means I have more information than the state technically does at this point. And And then a little bit about how I broke up the data on this. So you'll hear a lot about like different pillars of spending in Maine. This was sort of guided, I think, by the Recovery Council, sort of decided their spending priorities, but it's also, you'll see it in, I think, Johns Hopkins, different advocacy groups or research organizations kind of put spending into 4 pillars, which is prevention, harm reduction, treatment, and recovery. And so the data I got from the state had already divided all the spending into these categories a little bit. So I just wanted to visualize them, so make them a little easier to see how things were, where the money was going. And so one thing I'll point out is harm reduction is the biggest circle there. And I heard from a researcher that, there's a lot of people who think that communities are not spending enough on harm reduction, and yet here we have evidence that they are. So those are, it's helpful to break it down into those different parts and then visualize it to make it a little easier to understand. And then lastly, to wrap this up, over the years, there's been a lot of spending on law enforcement in jails, and that was true for this data as well. So you can see in these circles, behavioral health liaisons and medications for opioid use disorder in jails in particular were huge spending categories. So visually, I wanted to point that out. And then I also, got into it in my story. But these are sort of 2 interesting uses of the money. I think advocates will say we absolutely need access to medications for opioid use disorder in jails, but they would rather this once-in-a-lifetime pot of money be used elsewhere. And then behavioral health liaisons, these are mostly people who work with police or sheriff's departments. They're supposed to help de-escalate, provide resources for people, but a lot of advocates also believe that there should be no spending on law enforcement. And it's also interesting to see just like how many subdivisions just put it towards that and left it at that and didn't really get creative or expand their vision, so to say. So that's a sort of a quick and dirty version, breakdown of this story. I have links to all of my reporting in the slideshow. That bit.ly link at the bottom is the slideshow with my notes attached, and my contact information. Feel free to email me. That's my phone number. You can call, text, signal, whatever. This is all public information, so feel free to reach out. I'll leave it up here for 2 more seconds, and then I'll also put it in the chat once I figure out how to stop sharing my screen.
Cool. Thanks, Emily.
And there we go.
Really appreciate the work you're doing, and still remain amazed that you were able to get that story out the day before they reported it to the State House. So a lot of hustle there, and just a lot of overall work behind the scenes to create your own database, which is, again, remains absolutely amazing. I'm going to elevate a quick question here, and I do know we're at time. Somehow we've gained more viewers as we've gone longer, which is great. So if folks have to jump off, the call is recorded. And no shame there. But I wanted to bring in this question from Scout here in Baltimore. And I think, Emily, you touched on this a little bit, but it might be helpful to kind of unspool with this question. So Baltimore is now starting to spend nearly $600 million in opioid settlement money. What do you wish you could have focused on as your areas were starting to spend funds? And what would you look at if you were day one? The money's coming in, and Baltimore is weird for a few different reasons. They kind of did it on their own. That's why their money isn't quite there yet, but the money's coming in. So there's reporters in Baltimore trying to figure out how do I get started? What would Emily, how would you suggest I get started?
Adam, I think you're muted, but I'll take that opportunity to start.
Yeah.
I guess I would just start with who's the decision makers, because you need to know who to ask. So who's in charge of the money and who's in charge of spending it?
In terms of what maybe could be a more effective use of spending, something came up in an interview that I did the other day with an addiction medicine source of mine named Kelly Ramsey, and she pointed out that we need more evidence-based. We need to be spending on evidence-based tools for medicine. So something, for example, something that is affordable and very useful in opioid overdose reversal, oxygen tank, or the things that you put on your finger when you go to the doctor to check your oxygen levels. Those are, for some reason, 2 very affordable tools that get very overlooked when we're thinking about evidence-based medical intervention tools. So I don't think that conversation's been happening, based on my reporting in Erie County and the city of Buffalo, really at all. Yeah, that's something that I wish was paid more attention to generally.
Yeah, and I think you both talked about too that planning process and just trying to figure out if you're in a city that is just getting started, or as you both pointed out, there's a lot of money still sitting around. Like, what is the plan? Who are you talking to create the plan? How are you executing the plan? And I know, Emily, you had that great story where you talked about, hey, they came up with a plan, and then when you followed up on the plan, you're like, it turns out nobody did any of those things in the plan. And then we've seen that actually bear out in a bunch of different places. So, Scout, thank you for that question. It's a wonderful question, and obviously happy to help support that reporting as you start digging in. I don't know that I see any other questions in here. And since we're already at time and nobody wants to hear me talk, I think the one thing that I would ask is if you had any like big picture takeaways that you wanted to leave folks with. I know that it's been a lot to report on this topic. It's a hard topic, both personally and professionally. There's a lot to navigate, especially because these are really big and long stories. So if either of you could both share maybe some tips and tricks for how to get that buy-in at a newsroom level and why you see it as important to like actually cover this money at your local level.
I can start. I mean, I'm really lucky in my newsroom. We're digital first, and we focus on investigative reporting. So this is our bread and butter. So getting buy-in is very easy. And sorry, what was the second part of your question?
Oh, just like a little bit of how do you kind of keep going? Because it is a big story, and there's so many different. It's an octopus, right? And so to commit that time and energy towards it, we really appreciate that you both are doing this. But as I can see how a journalist that's like, oh my gosh, this is huge. I don't know how to jump in. So if you have any advice for like how to kind of keep your chin up and keep going.
Yeah, I think if you can decide, this is all advice for myself as well. Like if you can decide first on like an organizational tool, like creating your own database is really helpful. And that does take some initial time, and that can sometimes be hard to get if you're in a daily newsroom. I guess I would just, if you have a limited amount of time, I would find your niche and focus on that. So I think Adam and I are doing a lot of very broad strokes reporting, but there are opportunities for smaller stories, and there's a lot of value in those. Like I kind of said before, like you don't have to tackle your entire state. You can start locally. I would just say like start locally because there may not be anyone paying attention to it, and you might find out that your town or your county has millions of dollars, and this is again a once in a lifetime pot of money to be used for like really important uses. Pay attention to that. And like I don't think anything is too small.
Yeah, no, I would agree with all those points. I think that I've said this to you, Jonathan, and I've said this to a number of different sources who I've helped me sort of interpret all of the dense material related to settlement funding and rules. It's a very lonely road at times. You feel like sometimes you're the only reporter on this, and locally you may be. I know that's the case here in Buffalo for the most part. So turning to OPI, reporting on addiction, getting help, finding new sources through Jonathan, I think it's a really important step when you feel overwhelmed. And yeah, just like having those conversations as you uncover more information, just to help you better understand it. And also for me personally, like I don't have a problem with buy-in similar to Emily at Investigative Post. I think we're pretty similar newsrooms in that sense, where we're digital first. But see if you can obtain some sort of stipend or scholarship to attend something like IRE. So I did an IRE bootcamp, data bootcamp back in January, and that really helped me start to think about how I can create databases, how I can organize my material. And yeah, just like if you're in a collaborative newsroom, turning to colleagues and being like, this is what I found out today. And maybe you might feel more comfortable doing that, as I have with colleagues before you bring it to an editor. But I think, yeah, you have more resources than you think, especially with Jonathan and other advocates and sources. Like, I really do believe that it's really helped me stay in the game, honestly. But yeah, I mean, there are great opportunities out there. And yeah, for me personally, IRE was one of those that really helped me in my reporting, not just on opioid settlements, but just generally when I'm looking at a lot of data. I'm way less overwhelmed now.
I would also, just to add to that, just felt like do traditional source development, go to meetings, go to events, because you'll meet people who really care about these things, and then they'll call you when things happen. You know, in Maine, there are like dependable people that when something in, X county is not moving along or moving along in a direction they don't like, they will call us. And those are really valuable connections because you cannot possibly be everywhere. So just showing up at things over and over again as much as you can, letting people know you're interested in it, because there are people in your communities that are probably paying attention and want to talk to you. So following through on those connections as well.
Yeah, you're both so awesome. Thank you, Emily and Adam. I'll say too, one of the things that Reporting on Addiction helps folks out with is that FOIA, Oprah, all of the different names for those public records requests. So we do have support with that through Muckrock. If you're a journalist that's on this call and you're like, how do I even do some of those things? Those are the types of things that we're able to help you out with. So Emily, Adam, I mean, we could talk forever on this. Your reporting is fantastic. I really encourage everyone on the call and watching the video to make sure you dig into it. I can tell you it's not going to stop today. There's a lot more stories that they're both working on that are really exciting. So keep an eye out for that. And thank you all for tuning in. If you need any help or support, please reach out to Reporting on Addiction. We're here to help out. And Emily and Adam were kind enough to share their contact information too. So make sure you use the sources that you have. And like Adam said, there is actually a community of folks that are doing this. It's really cool when those folks connect and share what they're learning and start digging into this, because it's an incredibly important topic. And your audience really wants to know what's happening. That when you put yourself out there, you'll be surprised how many people pop up and say like, oh, thank you for reporting on this. So I do want to express again, thank you both for reporting on this, and thanks for taking the time to share your information today. Bye, everyone.
Thank you.